I have no financial relationships with any entity producing, marketing, reselling, or distributing healthcare goods or services consumed by or used on patients.
Imagine for a minute you're a hardworking primary care physician who finally decided to take your own advice and take time for yourself. You just finished a 3-week vacation in Costa Rica. It was an amazing trip, one you'll remember forever. You've never felt so relaxed, and that's partly because you purposely stayed away from your phone, avoided TV, and did nothing except take it easy. Well, nothing lasts forever. Your flight home was unremarkable, and you even had an open seat next to you. After landing, you finally allow yourself to think about all the work that's waiting for you. You don't notice how empty the airport is. It does seem like your flight is the only one there. You get your bags, find your car, and on your way home, you remember to take your phone off airplane mode. Almost immediately, your car's filled with a cacophony of bleeps and tunes, indicating a mountain of texts and emails awaiting you. As you read through the messages, you get the sense that you've missed an important event. When you left, there were reports of a new illness in Wuhan, China. Now the novel coronavirus has taken over nearly every aspect of life.
In this podcast, we will bring you interviews with medical experts in our community. At times, we will also interview speakers from around the globe who have topics of special interest to our listeners. Our goal is to bring you high-quality, up-to-date information, help you meet and learn about those practicing around you, and make Northern Utah the best place in the world to practice medicine. While we may be the ones privileged to interview our guests, all of you can participate. Our website will have links for you to leave messages, which we will include in upcoming shows. Please note that the opinions and ideas shared on this podcast are those of the speakers and not of the opinions of Ogden Surgical Medical Society or its board or our employers. While medical topics will be discussed, it should not be taken as strict medical advice, and individual clinical judgment is warranted in applying information to patient care. It is the responsibility of the listener to judge for themselves the applicability of the information discussed with regards to their medical practice.
Welcome to the official podcast of the Ogden Surgical Medical Society. Since 1946, the Ogden Surgical Medical Society has been educating our medical community. In this podcast, we will bring you the voices of medical experts in your community and from around the world. My name is Clark Madsen. I'll be one of your hosts for this podcast. I'm a family physician and sports medicine physician, and I work at McKay Hospital. I'm a member of the board of the Ogden Surgical Medical Society.
Jake Saunders. I'm also one of the hosts of this podcast. I'm a resident at McKay Family Medicine Residency. I'm currently a third-year resident, and next summer I will be working at Midtown Community Health Center. Dr. Adomako is a board-certified infectious disease physician at McKay Hospital in Ogden, Utah. She received her medical school training from the University of Ghana. She then completed an anesthesia and general internship at the University of Ghana in Accra. Then she completed an internal medicine residency at Good Samaritan Hospital in Baltimore, Maryland. She received her fellowship and master's in public health and tropical medicine training from Tulane University in New Orleans, Louisiana. Following this, she worked as an infectious disease physician with Franciscan Medical Specialists of Northwest Indiana and as a vice chairman of the Infectious Control Committee and on the IRB for Methodist Hospitals of Northwest Indiana. She has worked at McKay Hospital since 2014 as the infectious disease specialist, involved in patient care in both the hospital and clinic, as well as administrative duties in antimicrobial stewardship and infection control.
All right, Dr. Adomako, on top of that very impressive CV that Jake just read for us, you're also the president of our Ogden Surgical Medical Society. And I think you get the great honor of not only being the president for this year, but I think it was just decided you get to be the president for next year as well. So I don't know what you did to earn such honors.
More like, what did the coronavirus do to give me 2 years?
Well, I mean, that's kind of what we wanted to chat with you today about. We want to spend a few minutes to get your opinion about what's going on, both as the president of our medical society, but also as an infectious disease doctor. Kind of what's going through your head right now? How do you feel about this whole new world that we live in?
As you're fully aware, my theme for this year was, for this year's conference for the Ogden Surgical Medical Society, was infectious diseases. The idea behind the theme was to show the importance of infectious disease in the field of medicine. Little did I know that there was going to be a virus to make the whole world aware that infectious diseases are really important. Now, what goes through my mind, what I think of is we have these little organisms who personally I think tend to be much smarter than we are because they tend to mutate. And every so often they come up with these diseases that we find difficult to treat. Basically, this is just telling us that infectious diseases are very important in every aspect of the field of medicine. Because as we can tell, everything is basically, we are all focusing on this pandemic right now. Elective surgeries have been canceled. We have providers who are specialized in various fields of medicine all contributing to help us all overcome this pandemic.
And as you're saying, this has all happened because of this tiny organism that's just way too small to even be seen. And I think that's just extraordinary. Well, let's start off really quickly asking you, most of our listeners here are familiar with the Ogden Surgical Medical Society. And, this is a meeting we've been having for 74 years in a row. And this was going to be our 75th. And it's the first time, I believe, in that time where we haven't had a meeting. And I imagine that decision was extremely difficult. Can you tell us a little bit about how that decision was made? Now, looking back, pretty much all the meetings have been shut down, but kind of what was the thought process in closing down the meeting for this year?
As you are all aware, we all work in Utah, and the Intermountain Healthcare System came out with a decree that all continuous medical education activities were canceled for the next 60 days. This was at the end of February. And our meeting was going to be held from May 12th to the 17th. So the thought, after discussing with the board, was, could we hold on and see whether the meeting could be held, whether they would be able to get this pandemic under control so that we can open up the meeting on May. But upon further discussion, we realized that this was, can I use the word rolling pandemic? We were learning more about this organism as we went along. So we couldn't tell for sure that everything would be controlled within 60 days. And we could not defer it down the road for a month, 2 months, or 6 months because we did not know where we were going with this pandemic. So based on that, the board of the organization decided that it is much better to cancel it and plan for it to be done next year or to be held next year.
So that's been a difficult decision for sure. And I think part of what you were saying is we just don't really know how long this pandemic is going to last. Do you have any sense?
No. If I'm not mistaken, at the time that we held the meeting to discuss whether this conference had to be canceled, held, or postponed, we did not have a lot of cases in the United States. And within a period of a month, the United States is leading the world in the number of cases. So that clearly lets us know or tells us the uncertainty or the progression of the disease. How long is it going to be around? When are we going to be able to what is called flatten the curve? Because we already know it is here. So we cannot prevent that, or the hope at this time is to try and contain the disease. And the way we see the number of cases coming up, it does not look as if it's something that we have any control over. It appears that the virus is giving us the timeline. So based on that, the idea is let's just give it as much time and just move it to next year.
Dr. Adomako, you mentioned kind of flattening the curve. Here in Utah, we've noticed that we've had a fair amount lower cases than the rest of the United States. Do you feel like we're doing an effective job at flattening the curve, or is this more of a result of our more sparse population?
I believe we don't have that many cases because of the population density in the state of Utah. I don't think we have as many people in the state of Utah per square area compared to what we're seeing in New York. We, however, continue to see a lot of new cases. And when you look at the graph provided by the health department, we just keep on going up. We don't have any flattening as yet. We don't see the curve coming down as yet. So, no, I do not believe that we have gotten there as yet. But I think it's more because we don't have that population density. Now, I must, however, mention that schools were closed when I believe sometime in March. And there was what we call the soft closure. And some restaurants, some individuals may have made a decision to stay at home. And then we also have the governor of the state issuing the decree to be safe at home. We have a few counties that have said for us to stay at home. So I'm hoping that with those measures in place, maybe we'll see a decrease in our numbers, but no, not yet.
I think we're all hoping for that.
Yes, we do not want to see the surge. We are all waiting for that, but we haven't seen it as yet. We hope not to see it, but it is possible that could happen.
Are you able to put on your prognostication hat and give us a guess of when you think that's going to happen? That's putting you on the spot. What do you think?
No, I leave that for the mathematicians. Because we have a few projections. Some tell us that if there's no social distancing, we expect to see a peak getting to the end of April. If we have about 30% social distancing, we may see sometime in July. If we have 50% social distancing or physical distancing, we may see a mild bump around October. So no, I cannot tell you when.
Well, I think that social distancing estimate's an interesting thought. I mean, really, that's been the main way we've been attacking this pandemic, is just to stay away from everyone. And hearing from medical experts like yourself that this is the best thing we can do, I think is really important. I've, talked to many patients, family members, other physicians, and this is kind of a new world for all of us. And a new approach to treating this problem. Looking in the past, we've had pandemics before in the past. Do you see any resemblances? There's been a lot of thought that this looks like the Spanish flu in the past. But what are your thoughts? Any resemblances to things we've been through before?
I haven't in my lifetime, I haven't seen this pandemic. We all, like rightly said, we've all heard about the Spanish flu. We know we had a few outbreaks of the other coronaviruses, the MERS-CoV, the SARS-CoV, but those did not appear to be as easily transmitted as this current virus we're dealing with. And no, I have not seen any pandemics this bad. Though, let me backtrack. HIV has infected a fair number of people in the world. We have tuberculosis, we have malaria. So I guess you could say those are pandemics as well. But this particular one, I guess you could say it's in a world of its own.
And what do you hope that we, as a society, can kind of learn from this pandemic a little bit?
That hygiene is very important. That infectious diseases are important. What I see is that it's a global world, because we know it originated in China. We thought China could contain it. It wasn't contained. We saw it in Europe, and now we see it in the US. I think it tells us that we cannot live in isolation. We need to learn to come together to help combat some of these infectious diseases and in general, most ailments, because we know, again, like I mentioned before, HIV is worldwide. Tuberculosis is worldwide. We saw the outbreak with Ebola. We needed the whole world to come together, where they were able to come up with a vaccine. They were able to contain it by coming together to work and come up with discoveries. So working together to come up with treatments, sharing what they know based on the kind of cases that they've seen, how they manage their cases.
Well, I was thinking, while you were talking, I remember back in medical school, learning that in centuries past, the leading cause of death was usually infectious diseases. But in our century, that's really changed to more lifestyle related problems. This kind of throws a wrench in that theory, or that these infectious diseases are roaring back, and they're not just something that we could throw antibiotics at, or our superior knowledge. We're still subject to these tiny microorganisms.
That is true. We are subject, and it's not just the viruses, because we have, as you mentioned, we have multiple microorganisms. We have some known as bacteria, the viruses, the fungi. And even before coronavirus came up, we were dealing with the issue of multi-drug resistant organisms. It seems as if these are on the back burner right now, but that's still a major issue that we have to deal with. We don't have enough antibiotics being produced to overcome these multi-drug resistant organisms. And now we have a virus that we know mutates. But most viruses in general tend to mutate. And this one just somehow did a fairly smart job in mutating, becoming easily transmissible, and causing fairly severe infections.
Well, I think those drug-resistant bacteria and microorganisms are definitely going to be a topic for an upcoming podcast. That's an area we definitely want to delve into. One question I had for both you and Jake, I kind of want to take a little different turn with this conversation. This virus, as compared to, like you were saying, malaria or tuberculosis, most of us don't live day to day worrying about how malaria and tuberculosis is affecting us, at least not here in Utah. But nowadays, I'm pretty sure most people in the world are thinking about this coronavirus. And I want to get a sense, how has it affected your life, Jake, and your life, Petronella? How is this already affecting your life?
I realized when the decree of social distancing was made, I then realized that I had been practicing social distancing all along, because I go to work, I come back home, I go grocery shopping occasionally, come back home. So basically, I thought my lifestyle hadn't been changed, but I realized that people have become a lot more conscious about what they do. You see a lot more people washing their hands, using the hand sanitizers. How has it changed my life as well? At least I can't go to the grocery shop and get toilet roll easily. I cannot go on my vacation that I had planned for at the end of May. Now that's me being selfish. But again, comes back to my point that this is a global world. We have this virus that has affected every aspect of everybody's lives. We now have people who are afraid to even go outside because of this virus. So, but personally for me, I think it's about status quo. I think I've been doing what I'm supposed to do.
So the world's basically just coming around to your way of living anyway. So
I think so. My husband may think otherwise, though.
How about you, Jake? How's it affecting your life?
As a resident, we're still pretty busy. I mean, it's been actually a little bit lighter in our with our schedule right now. Our home life, well, my kids they've gotten pretty bad cabin fever right now. They're bouncing off the walls and excited to get outside, and they're missing their grandparents and things. But I think kind of the big thing that it's really kind of impacted me is I feel like this constant sense of like a wave is about to come and hit us, but it keeps not coming. It's like an eerie feeling of this of dread, almost that something's coming, but yet it hasn't come yet, and it's almost eerily quiet right now. But right now, I mean, life continues different, changing plans and things that we have to do differently, but it still kind of works just the same a lot in medical field.
How about you, Clark? How has it affected you?
Oh, well, I'm glad you asked. It's been a big change for me too. I'll agree. I've actually, from my professional life, I'm in family medicine and sports medicine, and that's dried up. And in many ways, my athletes that I take care of aren't in their sports right now. So a lot of these chronic injuries that I'm constantly treating people for and telling them they need to rest, they're actually forced to do so. So I'm a little happy about that, but I miss a lot of what we used to do. I'd say, though, the biggest change is, I'm working more from home, talking to patients on video and phone, and my kids are always here now, and it's been great to get closer and spend more time with them. But I'm sure, like Jake said, they're antsy and they're ready to go. One other thing that I've been thinking about is, even with this meeting for this podcast, we were, even just within the last few days, we were planning to do this in person and all of us talking together in the same room. And this new virus has caused us to stop and think of every interaction we have with each other. And is it essential? And is it going to put us at risk? And so as we were going to meet together, we've already switched it. So even though those listening may not be able to hear this, but we're all in our own homes talking right now over a video chat and recording it for you to hear. But this is, I'm sure all of our listeners are going through that same thought processes of, is this the right thing to be doing? Even to just say hi to my neighbor, it makes you second guess yourself.
Yeah, that's true. I mean, clearly the physical distancing is more to prevent the transmission of the infection. But one would hope that once we have it under control, we are able to go back to socializing with each other in person. But we always need to think about the other person. Am I ill? If I'm ill, then maybe I should not be necessarily hanging around someone else with the probability or possibility of transmitting that infection to that pet, to that individual. Maybe from now on, we should be more conscious about sanitization, washing our hands. So basically, I think it's also going to get us to think a little bit more about others instead of only ourselves, maybe.
So, Dr. Adomako, kind of changing gears a little bit. Have you taken care of any COVID-19 patients, and kind of what's your interaction been like with that?
I've taken care of just a few. Maybe I'm touting the horn of Intermountain, but I must say I love working for Intermountain, because to me it seems that we were learning more about this organism, they were putting measures in place to try and deal with the situation as it arose. Clearly, we've had to change so many things along the line. In terms of going in to see the patients, I felt comfortable with my protective gear. So just went and spoke with those individuals. We haven't had a problem as far as I'm concerned with the personal protective equipment. Now, in terms of taking care of these patients, it makes me realize that we have a lot more to learn about this organism. As the days go by, as the weeks go by, we learn different presentations. When they first started, we had fever, cough, shortness of breath. Now we're hearing that, okay, it could be nausea, there could be vomiting, there could be diarrhea, there could be loss of smell, there could be loss of taste. So that makes it, interesting as we go along. And then it is also concerning the rapid deterioration we see after a fixed duration, because we have also heard that they may have the symptoms and then about 7 to 10 days later, they develop the complications. And we have been seeing that. And we've had individuals who've been on the ventilator for a number of weeks. So far, we may not have gone to a month, but clearly we are the beginning of our care. So who knows how long these individuals are going to be on the ventilator. And it appears to me as if it's mainly supportive care that has been tiding these patients through.
That brings up a really good question that I've been meaning to ask you. I, to this day, still hear from some physicians who feel that this may just be a really bad cold, and it's not as serious as we're making it. From your point of view, kind of what do you see as the seriousness and the long-term consequences of this virus?
Well, with a serious cold, what does one have? Okay, you get a cold, you get the runny nose, you get a cough, you have the fever, you have the muscle aches, then you may have a pneumonia. We treat with antibiotics and you recover. What we are seeing here, granted, we know that the majority of patients, about 80% or so, do not have severe symptoms. But what we are seeing here are individuals who have underlying medical conditions such as diabetes, heart disease, high blood pressure, who develop the symptoms, and then after about 7 days, they develop severe complications where they have respiratory failure. They cannot breathe on their own. They have to be put on the ventilator. You are providing some supportive care, and they just seem to be going in the wrong direction. And that's where the concern lies, where you have a disease or an organism that causes an infection. And instead of seeing what we would expect would be recovery within 7 days, what you rather see would be complications. We know that there are comorbid conditions that can predispose to it, but then you can see young individuals, 29, in their 20s, 30s, 40s, who just suddenly deteriorate.
And then on top of this, we have, people out in the media and the community and even public officials saying that, this is easily treatable with certain medications we already have. I imagine many of our listeners have reviewed some of these preliminary articles that are out there for medications like Plaquenil or losartan or azithromycin or these others. What are your take on these supposed treatments that are out there?
Well, with a fair number of the viruses in general, we don't usually have medications for viruses. And we've had coronaviruses around that cause regular colds, but they don't cause severe colds. We don't have medications for those ones. We just expect the body to get rid of it. We know some of the recommendations have been based on the study done in France, that the patients were given hydroxychloroquine and azithromycin. The problem there is that it was a very small population. So you cannot really make a well-informed decision based on a very small population. We know the hydroxychloroquine, the thought behind the way it works is that maybe it prevents the virus from getting into the cell. But in terms of killing off the virus, we don't know for sure. I know in the US, the FDA has approved the medication to be used in trials. So I know there are a lot of trials going on to see that it's actually effective. Just as the N for the France study was small, my N is also quite small. I've seen only 5 patients, and I really have not seen significant improvement on the hydroxychloroquine. So that's why it's important for us to have well-controlled studies to really know for sure whether it's effective or not. But those medications, as far as we know, do not cure the infection. We are waiting for the studies to help us through.
I think I read that same French study, and I was really impressed that it really wasn't a well set up controlled study. It was basically, we had a ward with these patients, we gave them medicine, and this was the outcome. And we're making worldwide recommendations on it. And even our state health officials for a short period of time were recommending we treat it. Until now, we've taken a step back, it seems, and are going through a more pragmatic, evidence-based approach to figuring this out.
Yes, because those medications are not completely safe. I know that people out there who say that they prescribed it for their patients with rheumatological conditions and they've tolerated it for years. Again, my N is so small that it counts for nothing, but we cannot give it with people who have QT prolongation because it can lead to cardiac arrhythmias that can cause death. We've had to discontinue it for side effects. And again, ignore my N. So we'll just wait for the studies. But I would not recommend that everybody go out there to take hydroxychloroquine. We should wait to see what the studies show.
What about some of the other medications that have kind of been proposed? Have you had any experience treating any patients with remdesivir or with convalescent plasma or any of those other kind of newer therapies that have been kind of touted?
Well, the remdesivir, it was initially being used for compassionate use. And now it's the idea is that people be enrolled in therapy, enrolled in trials, we have not been able to get any of those medications. So I don't have any patient who's been on remdesivir. There are other medications like tocilizumab, which is kind of like an anti-inflammatory, because the thought is that when an individual has infection, some of the complications that arise is this huge cytokine storm, and the tocilizumab is to help with the cytokine storm. That medication I haven't used as yet because those patients haven't met the indications for that as yet. So I don't have any experience with those medications.
Well, we definitely don't want to keep Dr. Adomako too long. She's definitely working very hard right now. So I think we want to start closing this up, but I had one question I really needed to ask you before we close. And that is, heaven forbid you get exposed and start having symptoms and end up being quarantined for a few weeks. If that were to happen, do you have any hobbies or things that you'd like to do during your 2 weeks stuck at home?
Well, I get to hang out with my 6-year-old. Is he 6 or he's 7? What are we?
I do that with my kids all the time.
So I get to hang out with my little boy for 2 weeks. Hobbies. What do I like as hobbies? I used to say I like dancing. So maybe I'll finally get around to practicing my dance moves on Just Dance. But that's about what I will do.
There you go. I would love to do that with you sometime. I'd love to see that when this is all over and done with and we can meet together.
Amen.
Have a dance party together.
Well, how about you, Jake? What would you do if you got quarantined?
Oh, I'd probably catch up on some reading, spend time with family, probably catch up on some missed sleep, certainly.
Yeah, I agree. That might be the case. I have all these things I would like to do, but I'm sure it would just end up cleaning up after my kids most of the time. So, well, we've been very fortunate today to have the president of the Ogden Surgical Medical Society, Dr. Petronella Adomako, here with us to talk to us about the COVID-19 infection and the unfortunate canceling of our 2020 Ogden Surgical Medical Society meeting. Dr. Adomako, we're super appreciative of you spending time with us, and especially for the hard work you're doing to help the people here in the Ogden area. So thank you so much for joining us.
Thank you so much for putting this together. Awesome job.
And we also want to especially thank our listeners who are out there helping in their own communities. And we really appreciate the hard work you're doing to help make the world a healthier place. Thank you for joining us today.
Okay, thank you.
This podcast is produced by the board of the Ogden Surgical Medical Society. Teresa Puskedra is our executive director. Today's hosts and producers were Dr. Clark Madsen and Dr. Jake Saunders. Colton Gomez did editing and sound design. This podcast is funded by contributions to the Ogden Surgical Medical Society. We again want to thank our members for their long-term support.